Hello everyone. My name is Jacqueline Torres, and today I will be presenting the effects of Pilates on patients with chronic low back pain. PTs and PTAs working in outpatient physical therapy will treat a large population of patients with chronic low back pain. Traditionally, the standard exercise of choice for these patients was to prescribe lumbar stabilization exercises. These could include a series of exercises that started with mobilizing the lumbosacral spine and then progressing toward stabilization. Some of these include anterior and posterior pelvic tilts, single kneaded chest, bridging, reciprocal arm and leg motions, prone and cat dog stretch, and 4-point to 2-point progression. A more contemporary treatment approach for patients with chronic low back pain today includes the use of Pilates. Pilates is a mind-body exercise used to improve core stability. The exercise includes flexibility of arms and legs while activating the muscles of the core. These include the transverse abdominis, internal and external obliques, and the multifidus. Posture should be maintained by a neutral and elongated spine while performing rhythmic breathing exercises. Which brought me to my clinical question. I wanted to investigate if, for patients with chronic low back pain, are Pilates core stabilization exercises more effective at managing pain compared to traditional lumbar stabilization exercise or no exercise? First, I wanted to investigate what the literature had to say about the appropriate application of Pilates. So the first study I chose was a survey collected from 30 Australian physical therapists who treated patients with chronic low back pain and who prescribed Pilates on a weekly basis. The results of this survey produced a consensus on the clinical application of Pilates, which includes that Pilates is a mind-body exercise that required a series of coordinated activities. That sessions should be 30 to 60 minutes 2 times a week for 3 to 6 months. The Pilates requires a tailored treatment approach by a trained specialist. And that group sessions can begin once a patient is familiar with the principles of Pilates. Pilates should also include a home exercise program, and individuals can be progressed onto equipment such as the reformer. Next, I wanted to investigate the effects of Pilates on healthy individuals. In this study by Promfit, he took 40 healthy men and women volunteers who were randomly divided into 2 groups. One was a Pilates mat exercise group of 20 who participated in 45 minutes 2 times a week for 8 weeks, compared to normal physical activity 2 times a week for the same duration. The purpose of the study was to measure the effects of Pilates on stability and flexibility. Outcome measures were collected with the use of pressure biofeedback and a sit and reach test. The results showed that at the end of 4 weeks, 65% of the Pilates group passed the lumbopelvic test versus 0% of the control group. At the end of 8 weeks, 85% of the Pilates group passed the lumbopelvic stability test versus the control group at 0%. Also, flexibility made a steady marked improvement in the Pilates group versus the maintained flexibility measures of the control group. My next study was a systematic review and meta-analysis. Pereira took 5 randomized controlled trials and compared the effects of Pilates on patients with chronic low back pain. Pain and disability measures were collected using visual analog scale, numeric rating scales, and disability questionnaires. The first study compared Pilates versus control. The Pilates group had a decrease in pain and improvements in function. The second study was Pilates versus lumbar stabilization exercises versus control. In this study, there was a decrease in pain in only the intervention groups, but no difference in function. The third study compared Pilates versus control, had a decrease in pain in the Pilates group, but no difference in function. In the fourth and fifth studies comparing Pilates versus massage and Pilates versus stability exercises, there was no difference in pain nor function. When comparing all 5 studies, Pereira found no difference between pain and function, between Pilates and lumbar stabilization, or no exercise. Another randomized controlled trial by Nator studied the effects of Pilates in 60 patients with nonspecific chronic low back pain. Pain and disability measures were collected using the visual analog scale, disability questionnaires, sit and reach test, and the use of anti-inflammatory drugs. Both the Pilates group and the control group were allowed to take nonsteroidal anti-inflammatory drugs. The results of this study showed improvements in the Pilates group in pain, function, quality of life, and also the Pilates group took less nonsteroidal anti-inflammatory drugs. In conclusion, we establish a consensus in the clinical application of Pilates. Pilates was found to be the same as lumbar stabilization exercises for managing chronic low back pain. Pilates can help to improve pain and function in patients with chronic low back pain compared to no exercise. The improvements in pain and function were short-term. None of the studies collected evaluated Pilates beyond the 24-week mark. Pilates improves lumbopelvic stability and flexibility in healthy individuals, which can suggest that it can prevent injury of the spine. Recommendations are made for future research to identify what the application of Pilates means to fitness specialists and physical therapists at a global level, and to evaluate the long-term effects of Pilates on patients with non-specific and specific chronic low back pain.